you guys? We got another episode of America for Non-Americans, Healthcare. I'm going to address the difference between doctors in America and doctors in other countries. 99% of stuff is either insured or not insured. And the 1% is like our primary care physician's office. They no longer take insurance. But for us, we love our primary care doctor. And so for us, we're willing to spend, $100 to see him, and he gives us his time. But if we were coming out of the gate and we had to meet a new doctor, pay that $100, and we don't know anything about him, and this is a test visit, doctors in America do not give you consults. They charge for every flipping minute that they don't spend with you. I know I sound crazy, but it's true. I mean, my orthopedic surgeon, he's part of this system that...
It's really a simple rule. If they take private insurance, they will not see you unless they're billing you. There are exceptions like plastic surgeons, people who don't take insurance will see you and give you a quote and say, here's what you need done, here's how much I think it will cost, and give you some, basically like a little sales consult. But if they take private insurance, they don't do it.
And I think that's what the crux of the problem in America is. If you're gonna go see a plastic surgeon because you want your breast done, let's say, all those visits to the plastic surgeon are free until you decide, I'm going to do this, and he has you meet with their billing person. You pay a flat fee, like $6,000 for your new fake breasts, and then if you've got problems, he sees you for free after that. This is what I don't understand in America. If plastic surgeons can cut costs and keep costs contained and have their own anesthesiologists and OR operating rooms, ORs, and can do this for $6,000, how come conventional insurance can't? How come a knee replacement is so insane? $70,000.
I think the simple answer is there's a lack of cost control. You would think that the insurance companies would be out there hammering down, pushing down costs, telling the doctors, no, you can't charge that. Telling the hospitals, no, you can't build a new wing. But the doctors are constantly charging more. If you look at your average suburban hospital, certainly in our state, in the last 20 years, it's expanded, and everything's got to be new and fancy. We could probably look down to Mexico to see what they're doing, but we've built this wall that we can't see over, so we have no idea what kind of health insurance happens down there. And
those Canucks,
Canadians, those guys are nuts. We don't want to follow any example of those guys that get rid of pennies. Oh no, I'd rather have 6,000 pennies in a drawer in my cabinet than move into the future and say we're done with pennies.
Okay.
It's like any change, unless somebody's making money on it, we're not going to do it. My God, you would think, pennies. Why?
All right, you guys. So I think we're done. If you've got questions, put them below. We will respond in another episode. I'm going to collect anybody's comments about what I've missed about the healthcare system and about the fact that, like I said, I just want to re-stress this. The minute you see a doctor, even if it's only for 60 seconds, they're billing you. And you're going to get a bill, and you're going to have to pay it. And if you don't, they're going to eventually figure out a way to hurt your credit so that you have to pay them like they're a credit card. They really will. They will eventually bankrupt the entire American populace, which will then cause problems, because if they bankrupt the American populace, I don't know who's going to pay back the debt to China that we have. All right, guys, we're out. Comment below.